Hi everyone, welcome to Natural Medicine First Aid Workshop. And this is my first webinar for Natural Medicine Week. Thank you for joining us. And I can see that you've all put your mics on mute, so thanks for that. Now, as we go through, if you've got any questions, just pop them in the chat. I'll be able to see them pop up and I can either answer them now or at the end of the presentation. So first up, what I want to cover today is I'm going to cover some homeopathic basics. So when you look at naturopathic medicine, there's sort of three main areas we look at. We look at nutrients like vitamins and minerals. We look at homeopathics, which are very dilute remedies, and we look at herbal medicines. And traditionally, as a practitioner, what I've found is that herbal medicine are great for kind of managing chronic symptoms or long-term weakened immunity, hormonal imbalances, etc. But the homeopathics are really great for acute, what I would call acute situations, which is your coughs and colds, fevers, flus, that sort of thing. So I am going to cover some of the basics to use today. And if any of you would like a copy of these notes, because they're fairly detailed, and I know there'll be a couple of people who do presentations that will eye roll because there is a bit too much in the slides. But I just wanted to make sure you had that content. So I've emailed out a few of my links to a few of my blogs to you already, which provide some more information. But just for today, if you just want to, if you want a copy of the presentation, just email me back at the Christine at Elemental Health and I'll shoot it through to you. Now, the other thing we're going to cover is I'm going to go through my basic toolkit of immune support, the sort of nutrients and herbs I like for just general support. I think it's been really important the last couple of years. There's been a few nasty bugs going around and we're all trying to either minimize our exposure to them or our outcomes when we get them. Then I'm going to look at some management of common health issues, because I think a lot of the time, and I know particularly with the current COVID surges, I was talking to nurses who were saying people would, their children would test positive for COVID and they're bringing them into the hospital because they didn't seem to know how to manage fever symptoms and flus and the common things that we've all been doing historically at home. So I just want to give people a little bit more confidence, and I'm really going to focus in on what you can treat at home and what you should, when you should actually run screaming to the hospital. Although if you're in that anxious mindset, perhaps call for an ambulance. I'm going to look at how we prescribe homeopathically for some common fevers and a couple of stomach bugs, and also provide you with a resource list and some follow-up. So that if you're interested, you can go and have a look where there's more information. So first up, I just want to cover some general principles about what is homeopathy, because I mentioned it up front. So homeopathic treatment came out of herbal medicine. So the founder of homeopathy was a gentleman called Samuel Hahnemann, and he was a doctor about 250 years ago. And what he found was that as a doctor, he didn't have many things that worked. There were a few things that worked, and the rest of the time, the patient basically survived the treatment. So that wasn't a great outcome. And so he felt very uncomfortable as a doctor with those things in his toolkit. And so what he did look at was the things that were working. So for example, in Germany at the time, malaria was still prevalent, which, I find really surprising, but apparently this is they drained a lot of swamps. And one of the herbs they used was called cinchona. And cinchona was actually very helpful for the symptoms of malaria and really helped those people. So he actually tried taking cinchona and then got malarial type symptoms. So he got the chills and the fever and the recurring fevers. So his principle was what something causes, it can treat. Now, actually taking a herbal dose of cinchona is actually fairly full on. So, the symptoms are quite aggressive. So he also experimented with dilution and succussion to see how much they needed to take to get the same symptoms, and developed a principle of minimum dose. So it's how much do you need to treat the symptom rather than having, 5 mils of liquid herbs 3 times a day. And that's made the process of figuring out what homeopathic remedies do a lot easier on people. If they do go through what we call proving, they only get mild symptoms. Now, when we're taking a homeopathic case, there's a little bit more information than needed. So most of us are used to sort of this principle of, I have headache and it hurts, you know, and basically what do? You take Panadol and you take Nurofen, you know. If you're going to take Nurofen, don't do it on an empty stomach because that can be very unpleasant. But generally speaking, with homeopathic case taking, we've got a lot of different remedies. So you really need to match the sort of symptoms you have to that particular remedy. So it's a little bit like a jigsaw puzzle, but from the perspective of prescribing for acute symptoms like colds and flus, we're looking for the three-legged stool. So 3 symptoms that manage the case in front of you. So the way we find that is following this process that I put up on the screen. So we look for words for, you know, if we've got a headache and it hurts, we look for some words for pain. So when you think about a headache, is it throbbing? Is it dull? You know, is it, I'm trying to think of some other words for it. You know, do you feel like your head's going to explode? Those sort of things. The other thing I find really helpful is not just asking people where the headache is, but getting them to point to it, because a lot of people don't have a great understanding of anatomy and physiology. So they will say, you know, it's my temporal bones hurt. And that's like not your temporal bone, that's your jaw. So if your jaw's hurting, it might actually be toothache, not headache. But, you know, if they point here, then you know you've actually in the right region. So when in doubt, always ask people to point. The other thing we look for is what we call modalities, what makes it better and what makes it worse. So if you think about it, I've got a really throbbing headache and light hurts. The only thing that helps me feel better is lying down in a dark room. You know, that's kind of a classic migraine picture really, but you know, that's the sort of things we're looking for. And then we look to see if there was something else that occurred at the same time, and we go through that same process. So do you have headache and do you have fever? You know, if you've just got a headache, then you're probably looking at one thing. If you've got a headache and fever, it's more likely that there's some sort of infectious process going on as well. And then the last thing we look at is things like what were the triggers? So sometimes, you know, you can have a headache from sitting in front of a computer screen for 7, 8, 12 hours a day, you know, in which case it's more likely that there's some manual features. You know, it's probably coming from the base of the head and it's musculoskeletal. Occasionally it can be because I went to an event and everyone had the C word and I got the C word. So, you know, it's because you're around people who had that disease. So looking at what was the trigger can be really helpful. And the reason I mention this is one of the remedies we use all the time is called aconite, and it's really good for fevers that come on suddenly, but from being out in the cold. So it's literally like, and I have a client who's like this, she goes out, she lives in the Hills District up your way, Julie, and she goes out to the washing line on a cold morning, and by the time she comes back, she's coughing. So that exposure to the cold is what triggered her symptoms. Now, the other thing we look at with homeopathic dosing is how often do you give it? So typically I prescribe according to the urgency of that situation. So if someone's had, you know, and we're going to look at some sprains and strains, if they've strained an ankle, I'm going to give arnica really frequently, like every 5 to 10 minutes. And then stop on significant improvement. But if someone's sprained an ankle, I'm going to use it for 3 or 4 times a day for a few days until the ankle's feeling a lot better. Now, I'm going to go into some therapeutics, but first up, I want to just talk about basic immune support, because I think given it's May, it's cold, and most of the country at the moment, it's raining, maybe not so much in Deniliquin, but in other places it clearly is. So I want to look at the sort of things that provide really good immune system support and when you use them. Now, there's a bit more about this in my blog, Treating Colds and Flus. But what I wanted to start with is my old favourite, which is vitamin C. And I just had a vitamin C powder here, which I really like. It's an Eagle one. And it's actually called Better AC. So it's got a little bit of vitamin A. It's got C in it, and it's got a little bit of zinc. So it's basically all the cofactors you needed for the C to operate. The other thing it has in it is bioflavonoids. And the reason you want bioflavonoids in a vitamin C is because it helps recycle the C. So you get a lot more use out of the same dose. Now with vitamin C, if we either use it or excrete it. So typically when you're using vitamin C, what I'd say is be really conscious about the dose you're taking and see how much you can take when you're well and how much you can take when you're sick. So to give you an example, when we're at college, students love doing these sort of things to themselves. So we would take vitamin C to what we call, charmingly, and remember I'm a naturopath, so we talk about bowels all the time, bowel tolerance. So I'll let you imagine what bowel tolerance is. But for me, I can take 2 to 3 grams of vitamin C when I'm well and up to 7 grams when I'm sick. So your body really has that increased demand for vitamin C. But what I would say is to make it more comfortable on your system, divide the dose. So if I was going to do something like this, it's normally, this has about 1 gram of vitamin C per teaspoon. So I do half a teaspoon 4 times a day rather than doing a big dose first up. So I split the dose over the day. And because it's water soluble and it'll be excreted if I don't need it, it just means that I'm getting that dose through the day. And that's really useful immune support. I don't tend to take vitamin C except when I'm sick. I don't think you need to be taking it every day unless you've got allergies or something else going on. Now, the other cofactor I mentioned with C is zinc. And zinc, again, it's involved in about 300 different processes in the body. It's really important for the gut health as well as the immune system. And since 70% of your immunity is in your gut, it's a really good way to support it. So when I'm sick, I look for about 25 milligrams of zinc a day. And that's, if you look at most over-the-counter products, that'll be about the dose they have. Some may be lower. And you should always have a look at your other supplements too, because it's amazing how often your supplements will have 5 or 10 milligrams of zinc in. Now, if you're taking a very popular one that bioceuticals do called Armour Force in particular, that used to have about 15 milligrams of zinc, and people were supposed to take 2 tablets 3 times a day, which was about 90 milligrams of zinc. And that was a bit too much for some people. You could probably do it for a day or two, but doing it for any longer was really problematic. So just make sure you check on what's there for other things. Now, going into winter, the other, when we're talking about gut health, probiotics, and I should say all prebiotics, and I'm actually starting to really use a lot more prebiotics in my clinic now. In particular, I like the one called PHGG, which, because the word is partially hydrolyzed guar gum, and try saying that quickly 3 times. It's really tricky. But partially hydrolyzed guar gum is a really good source of a prebiotic fiber that, think about it as like fertilizer for all your good gut bacteria. So I find half to a teaspoon a day of that is a really good support. And there is an over-the-counter one that I think Aria do. And, if you can't find that one, basically the other best source of prebiotics is fibers in fruit and vegetables. So 3 cups of vegetables a day with lots of good variety. But if your immune system is challenged, or if you're dealing with young children who often, unfortunately, and particularly if you find when they go from kindergarten to school to high school, that can be the first year in that environment, new bunch of germs can be really problematic. It's really good preventive to have like a probiotic going in daily, like just 1 capsule or something that has a reasonable variety of strains. And that can just be really good support, particularly I think for younger children. It's often hard to get them eating that variety of vegetables. Now, one of my other really useful supplements, and I have to say I've been getting a lot of people to take vitamin D. I feel like I've never had 2 years where I've used vitamin D so extensively. But I actually was at a seminar on the weekend, they were talking 60% of people in Australia are vitamin D deficient. That means they have a level below 50 nanomoles per litre, which is regarded as sufficiency. And personally, I think it should be at 100. So if you look and say 60% of us are already vitamin D deficient, vitamin D is really critical for our immunity. It's also not really easy to get from food. And most people aren't really enthusiastic about the sources. So if you're not having a lot of butter or liver, and particularly cod livers, which I don't know if you've ever had cod liver oil, but it can be, yeah. that's a good summary, Julie. But often through World War II, they were giving out cod liver oil to all the children, and they had to have a teaspoon a day because it was really good for their immune health. But I think a lot of it was a bit rancid, so it probably wasn't the best source. Now, I found with vitamin D, and I'm holding up one which is a Biomedica one, which I quite like because it's in an olive oil, and I've found it's really nice for my nails as well. But I've been using 2000 IU, so that's 2 capsules. So usually a capsule of vitamin D is about 2000 IU. And what you're looking for is the D3 form, because that's going to be better absorbed and more usable for you. I've been using that as a preventative dose through winter. But what I would suggest is if you've got really strong cold or flu symptoms, hit yourself with about 5 capsules for a couple of days. Don't do it consistently, but just the first couple of days, go up to 5 capsules for 2 days. And it really can make a difference to the severity of whatever develops. Now, the other herb that's probably been one of my workhorses through this has been elderberry. And the really good thing is about elderberry is it actually tastes nice. So when you're using it in a herbal mix, it actually makes the formula taste like something that children would like. And my family, I have a big 500 ml bottle at home, and my family will go and happily do shots of it, which having been brought up by homeopath, they're not used to having liquid herbs. So they're a little bit resistant normally, but the elderberry is a big winner. And I think in the old days, elderberry wine was a big thing. So a lot of the wines and alcohols were a way of getting herbal medicines into people. So elderberry, which is marketed commercially as a product called Zambuccal, they have these amazing lozenges as well as the syrup and capsules. And that can be really useful for colds and flu, partly because I find most people are happy to take it. And I have to say, the lozenges particularly, I really like the fact that if someone's got a sore throat, it actually is coating the area where they're actually symptomatic. So it's got a little bit of zinc in as well as the elderberry. So it's a really nice combination. So I'd say have a look out for the Zambuccal, but the elderberry is a really effective herb for upper respiratory tract, and it's quite antiviral. And the reason that's important is it's something that can actually reduce the viral load, and that's going to give your immune system more of a chance to respond. And I can see Anne there saying that she actually took cod liver oil growing up and it was good. So I'm glad she actually had a nice clean source of it. Now, the other tea, there's actually a couple of teas I use therapeutically, and I put a little video up on my Instagram the other day of me making my favorite tea, which is lemon and garlic. And through, I've had, everyone else in my family except me has had COVID, and each one of them then wanted the lemon and garlic tea, but I'm not sure if they wanted it because of lemon and garlic or if they wanted it because they got a big dose of Manuka honey in it. I think they really like the Manuka honey. And I find Manuka honey is a really lovely antiviral, antibacterial, and it really makes a difference when you to use it with the teas in symptom management. So for example, I find I make up, it's a whole lemon quartered, and I like to use an organic one. Otherwise I scrub the peel because I don't want anything else on the peel. I just want that limonene, which is in the lemon peel for the antiviral effect and also for the flavor. So I put a whole lemon quartered, 2 liters of water and 5 big cloves of garlic in there. And I boil it, I bring it to the boil, and then I simmer it very low for about 20 minutes. And then I pour that off, and I've got, 4 or 5 cups of lemon and garlic tea. And you can have it sitting there and reheat. Interestingly, they've now brought to market a heat treated form of garlic, which they're finding is significantly more effective. So I'd always been taught that you use raw garlic for immune effectiveness. However, this heat treated garlic, which they don't bring to really high temperatures, but it's not dissimilar to bring it to a boil and letting it simmer, they're finding about 60 to 80% more effective. So it was interesting that traditional form of preparing actually now has some real science behind it and its usefulness. Now, the other tea that's really lovely is yarrow, elder, and peppermint. And that's particularly nice if you've got a cough. It really soothes that whole cough reflex. And it's interesting that peppermint, which is always one we think of for stomach, is actually really useful at soothing the lungs as well. Now, I'm going to talk a little bit more about homeopathics. So I'm just going to jump onto some of the homeopathics to think about. But most people's, it's funny because my daughter was at uni with a lot of people who were studying IT and software. And she said, Mum, none of them think that homeopathy works, but they all use arnica. And it's really interesting, the number of people who would use an arnica cream. Look, this is one of my faves, which is called Traumeal. And it's got the arnica in, it's a gel. And the reason I really like it is because often with creams, they can be a bit sticky. So they're really hard to rub in, whereas the gel just seems to absorb and it gives you really nice pain relief. So my husband's torn the cartilage in both his knees and he puts this on his knees every night before bed and it just helps him get off to sleep without them, you know, just creaking and aching a bit. So generally the thing for arnica is it's the first remedy we think about for any sort of knocks, falls, injuries, sprains, strains. It's also good for concussion. And what it does is it actually reduces the bruising and swelling. So one of the first things about, say if you sprain an ankle, because everyone I think has sprained an ankle, what happens initially is that if the ankle swells up, you get a lot more pain because you're putting pressure on. It's like there's a bubble putting pressure on the nerves and the muscles, et cetera, et cetera. If you can get that swelling down, you can actually then reduce the pain and you can start to mobilize and get the strength back. And it's really interesting because once upon a time we were told with the sprains, stay off it. And now they get, you know, if you go to physio, they get you moving as soon as possible. So the protocols around it have changed. I do think if you've got problematic ankles, a little bit of strapping or bandaging can be good because it just gives you that little bit of support. And I think it's almost that unconscious as your foot or ankle hits the bandage, you kind of remember, oh, okay, I've sprained it, so I just need to be a bit more careful and conscious of it. But generally, arnica is really good for anywhere where you've had a fall, you've got bruising. And it's really interesting if you actually have a bad knock and you get onto the arnica quickly, and I would say you do it as pillules and you can, or drops, and you can have 3-4 doses in the first hour. You'll find that instead of going into that big purple bruise and then the green and then the yellow, it'll move through the stages really quickly and you'll get really good recovery. So there's actually quite a lot of good work out there about arnica and research supporting its use. And this Traumeal is actually quite well evidence-based for mild injuries. So I'd say it's something, it's well worth having in your toolkit. And particularly if you have a young child, like I can see Louise has on her lap, he's getting his education in homeopathy. I don't know, mine always seem really prone to bruising themselves on their head. Like they seem to use their head as a landing point, maybe not. But that was really good for resolving those bruises really quickly. Now, conversely, if it's actually more of a nerve type injury, you know, if you've jammed a finger in something, really bad toothache, then arnica for the bruising, and hypericum is regarded as arnica for the nerves. So that can be really useful. The other thing that's really interesting about using arnica is that often it's interesting when people have an injury and they need arnica, they'll often go, I'm all right, just leave me alone, I'm fine. And that's kind of part of the picture. Now, typically they're not all right and you know that, and you just need to provide first aid. So just go ahead and do it. Now, I want to cover off on a couple of other common injury remedies as well, because these are really useful things to have in their toolkit. The notes go Ruta and Roost Tox, but I'm going to say with sprains and strains, Roost Tox is the first one I go to, and it's what we call the rusty gait. So, for example, you get up in the morning and you go, oh, can you hear that was my chair creaking and not me, okay? But it's that feeling, and as you move around, you find, you know, as you get warm and you move, you're okay. So that's really Roost Tox. So it's once it starts moving, we're okay. With Ruta, generally it's similar, but they're much more easily fatigued. And Ruta tends to be more about the hard surfaces. So like, when you've got an injury on the shins or the tendons. So if I have a sprained ankle, I'll start with arnica, get the swell. Once the swelling's gone down, I'll move to Roost tops. If that doesn't do it, I'll switch to Ruta. But generally speaking, 90% of the time, the arnica and the Roost tops are going to sort it out, along with your other first aid measures, obviously. Now, the first thing I want to talk about before we went into some more specific remedies is fever. So fever is a rise in the body temperature above the normal temperature. So it's really good to know what your normal temperature is. And I was going to say, I actually swiped my thermometer and took it home when my husband had COVID. So sorry about that, but I was just going to demonstrate. But it's good to know where your normal temperature sits so that you know when you've got a rise in temperature. So for me, I'm normally around 35.9, 30, like at the low end. So for me, if I've got 37 degrees, I've got a temperature. With other people, that would normally be in the normal range. So, and temperature is an incredibly valuable tool for illness. And someone's mentioned this. So the reason I would say it's a valuable tool is that the virus or bacteria thrives at your normal body temperature and can breed and replicate really, really quickly. And you have less time to respond to it. Temperature goes up 1-2 degrees, and all of a sudden it's an environment where it can't operate as effectively. And that means that you don't get as much of it and your body doesn't have to deal with as much of it. So it gives your body time to respond. And so the immunity or the white blood cells can go, okay, look, they can hoover up one of the little virus, take it back to the bone marrow and say, okay, look, it looks like this. Hey, we've had something similar to this virus before. This is what we need to produce. They produce the antibodies. They go and hoover up the virus. So if you can let a fever run, it's actually going to result in you being sick for a shorter period of time. Now, saying that, you don't want to let a very high fever run. You need to medicate or manage it really effectively. And what I would say is, for me, anything above 39.5 degrees, I'm going to be looking for support and treatment for. So I don't want you, because especially in young children, very high fevers can cause convulsions. And I have seen that happen with a younger sister, and it was really terrifying. Now, she was fine. It was just that her fever spiked really quickly. So the other thing with managing a fever is don't overheat them. Don't put as many clothes on them as you would have on you. Because sometimes with fever, if you're alternating between fever and chills, people can pile on the blankets and then their temperature will jump really quickly. So just make sure with fever that you keep people cool and comfortable. So don't overdress. If their fever is coming up, a cool sponge can be nice, but don't use ice. Don't shock their bodies. And keep up the hydration and keep up the rest. I actually quite like what I used to call the video diet, but that's kind of dating me now because I should call it the streaming diet. But, put them in front of the TV somewhere where you can see them and keep them with a, light blanket on or something, and just let them watch their favorite show over and over, whatever that is. So that works as well for you as for someone else, cool, comfortable, someone around to monitor them and keep up the lit and bring them, glasses of water and cups of tea. Okay, so when I want to talk about fever, I'm going to cover a few different remedies that are really useful for fever, because you can use homeopathics to manage fever. And I do find that using the homeopathics is a really useful way to support the body without losing that really valuable mechanism of reducing the amount of replication or, doubling, tripling of the viral load or the bacterial load. So often with any colds or flu, first stage is fever. You end up with, some people it can be quite quick. Other people can be more of a slow burn. The most useful remedies are aconite, belladonna, and ferrum phos. But what I would say is that typically, if you've got a situation where you've got a young child, or if you're sick and it's the middle of the night and you're trying to think about what to use for fever, I suggest you put aconite, belladonna, and chamomilla in a bottle, shake it up, and take 5 drops out of it every couple of hours. And you'll find that that is a useful, it's what we call the fever mix. And the reason I suggest that is because often it's really hard to differentiate between where I'm at, and it will work just as well. And it's a lot easier for a lot of parents. Now, the other remedy that is really useful for flu, and if given early can be really helpful, is called oscillococcinum, which is really hard to say, but it's marketed as Flu Stop in a yellow pack in Australia. So it is around and it's available in pharmacy and health food stores. And that's a really nice remedy for either. And look, I've actually come in here feeling my first stage of flu is always chills down the back of my spine. So I've been in here and come and taken a couple of doses and it hasn't developed, but you've got to get onto it early. All right, I'm just going to go quickly through some of the aconite symptoms, because I think that's actually, it's really useful to differentiate. But the thing about aconite that I want you to take away with, if you take away 3 things, is comes on really suddenly. So it's literally like I've been out in the snow, I come inside and my throat's really sore, I've got a really high fever, I'm coughing. So it comes on fast. And it's usually from exposure to cold. They can alternate between being hot and cold, but typically there's this cold pattern in there. The other thing is they're really anxious, and they talk about anguish and restlessness. But if I said anxious, it's almost like they're predicting that, you know, it's not I've got a cold, it's I've got meningococcal. You know, you think about the worst thing you can possibly think. Someone who needs aconite will be catastrophizing, basically. They're really, really anxious and worried. Now, as I said, it comes on quickly. It often comes on after midnight, which is always the worst time to try and deal with any cold or flu. And there's this intense anxiety in there. The other thing you can see is that the other remedy that I use a lot is called belladonna. And belladonna is often really good remedy for any of the itises. And when I say itis, it's any sort of inflammation, because, you know, if it's stomach inflammation, it's gastritis because it's in the stomach, and it's gastric with an itis on the end. So any sort of itis works well with belladonna, can be really useful for. And actually, apparently it is the Queen's remedy for her sinus. So we had the Queen's homeopath, Dr. Peter Fisher, out here many years ago for a symposium. And he was telling us, you know, I mean, he's not our only physician, he's a rheumatologist as well. And she had 14 different doctors. So I guess that's how you live to be 96 years old. It's not just the homeopathy. But look, the thing about belladonna that's different, this also tends to come on quickly, but difference with this is there's a lot more redness. And and you think belladonna, the pupils are dilated. So the substance that belladonna is made out of is something that women used to drop in their eyes during the Middle Ages to make their pupils seem dilated, because that was considered beautiful. I would not recommend that under any circumstances. Now, the other thing is that belladonna can be, part of the fever with this is very vivid imaginings or even hallucinations. So they can be the sort of people who, when they're unwell, will actually, you know, punch and kick and scream. And they can have really entertaining dreams in fever. So this is more, in some ways it's interesting. They've got this really vivid hallucinations and other things going on, but in themselves, they probably want to be quiet and in a dark room and away from people. So it's a little bit of contrast there. So belladonna I find really useful, and particularly with children, if they get that one red burning cheek and one pale, or the first experience I had of belladonna was, I'd actually gone to see my naturopath, and I looked terrible because I'd been up at, you know, crack of dawn or 2 o'clock in the morning with a child with an ear infection that I'd ended up taking him to a medical centre and had about 2 hours sleep. And he listened to me, heard about the symptoms and said, look, next time it happens, try giving him this. And it was belladonna. So of course, a couple of months later, same thing happened again. And I gave him the belladonna and he seemed to settle down a bit. I gave him another dose. He rolled over and went back to sleep. Of course, did I go back to sleep? No. I stayed awake for another 4 hours waiting for him to wake up, so, but it was a really interesting insight to what was happening. And look, small children are prone to ear infections because all their nasal passages and everything else are very small and they fill very easily with mucus and it gets inflamed and irritable. But I did find that was my first really amazing experience of homeopathy. So belladonna is definitely a big part of my toolkit. Now, ferrum phos is more what I would call the slow burn form of a fever remedy. So this is when really you think about it more when they've got fever and chills, but nothing really clear seems to develop. And these are the people whose symptoms don't come on very quickly. They're kind of sickly, but nothing's really developing. So ferrum phos is often talked about as being useful for that sort of picture. And again, can be useful at the start of any sort of cold or flu where you don't have really defined symptoms. And there's a real lack of any clear indicators for a remedy. So, it's almost like aconite, belladonna, quite well defined. This one, a little bit vaguer. And, when in doubt, use ferrum phos. Now, the other one I wanted to mention, because part of the current C word going around, a lot of people actually end up with gut symptoms from the current bout. And Nux vomica is a remedy that I use a lot in practice. And you can see on the screen the list of uses because it's really good for that postnasal drip you get after you've had a cold or flu and it's making you cough. And you're quite irritable with it. I always remember a colleague of mine's, because I rang her up and I said, I'm at the end of this cold and I don't know what to give it. I'm really irritated and I sound terrible because every time, I'm sitting here and mucus is dropping down the back of my nose and making me cough. And she said, you sound like you need Nux vomica, because I sounded really grumpy and out of sorts. And she was right. And it did the trick and just resolved that end stage. So it's good for that end of a cold, sniffles, but it's also really useful for crampy type stomach conditions with diarrhea and vomiting. And it can also be really useful for allergies. So it's a bit of a workhorse, this one. In fact, as a student, most of us only knew it as a hangover remedy. And if you look at, it's kind of useful for anything where you've overdone it. So whether you've been sick because you're exhausted from overwork, whether you've been feeling very unwell because you've had things that you shouldn't be eating and you shouldn't be eating, but gee, that was really good. And so overindulging in rich and fatty foods or overindulging in way too much alcohol and party. So that is one that is really helpful. And the sort of person who responds well to Nux vomica in terms of the mental symptoms is someone who's quite sensitive, and they can be sensitive to things like noise or touch or smell, or they may only be in that state when they're sick. So that's a really useful way to prescribe as well. The other thing I find Nux vomica good for is for someone who's been suffering from constipation, where it's that sort of constipation that's like, I go to the bathroom, but I never feel like it's cleared out. It always feels like it's a bit ineffectual. And the reason for that is because Nux vomica is really good for cramping. So it's that sort of your peristalsis in your bowel, which is the muscle contraction release, is not working really well. So the Nux vomica will just help push that along and get it working properly so that you clear everything out. So I just wanted to mention a couple of other things. It can also be good for children with teething problems who are generally very irritable and sensitive. And I have used it a couple of times with newborns who, because of the birth, ended up with like a constant sniffle. And it was really good for clearing the end of that. Now, the other one I wanted to mention in terms of colds and flu, because this is more of an infected cold or flu, so a second stage, is pulsatilla. And that's because pulsatilla is one that, interestingly, often is associated with that yellow-green discharge from the nose or other areas. and also recurring ear problems, so ear infections or sore, painful ears. And I've seen quite a bit of that with the current bout of colds and flu that are going around. And I'd say this one and hepatic sulf would be the two I would look at. Also very helpful for sinus and conjunctivitis. But the thing about pulsatilla is that the symptoms often move around, and it can be one thing in the morning and one thing at night. And so this can be really tricky when you're trying to prescribe, because you're going, well, I wake up and I'm full of mucus and I'm coughing, and then by the evening it's clear and I've just got a bit of a dry cough. When you get that variety in symptoms, think about pulsatilla. That can be really helpful. Now, in terms of the dosing, there's a couple more symptoms there with pulsatilla. One of the other things for people who need it, if you're trying to debate, I've got the sore ear and I'm not sure whether it's pulsatilla or hepatic sulf, pulsatilla is really thirstless. So they don't really seem to have any thirst, and they can't bear heat in any form, whereas hepatic sulf is often really chilly and can't deal with any change in temperature. So that can be just a good way to differentiate between those two remedies. Now, I did want to actually just cover off on a few resources. So at the end of the day, if you're interested in the homeopathics, this is one of the kits I use. It's from a company called Martin & Pleasance, and they're in Victoria, so you can get them online. What I like about that is it's about 24 remedies, comes with a little prescriber, so it tells you how to use them as well. But if you struggle, this is a really great book, and it's like having me on a webinar on about 100 different topics. So it goes through not only the homeopathics, but it also goes through basic naturopathic self-care as well. And it was written by a couple of naturopathic doctors in the US who treat a lot of kids with ADHD and on the spectrum. And what they found was they were doing really well on the homeopathy, but when they went back on antibiotics and things, they went backwards. So they wrote this book, and it's designed, and I'm going to stop showing you the PowerPoint so I can show you a little bit of that book. But it's available online, and it's like $25 through some of the book depository and that sort of thing. Now, the other thing is, if you're probably already following my page, but I do have a lot of blogs on treating yourself and your family. So if you're interested, just follow the blog. Now, I'm just going to say thank you for attending the workshop, and I'm going to finish the recording. And thank you again for attending.